Okay, so welcome everyone to our webinar that's going to be breaking down the personal statement blueprint. Now, the purpose of this webinar is just for us to sort of break down all the experiences you need to be focusing on in year 12, including your extracurriculars, supercurriculars, work experience, volunteering, what sort of things you need to do right now at this step, at this stage, to build our foundations so that when we get to our personal statement, we're not scrambling for, oh, I forgot to do this, oh, I forgot to do that. Everything's all in one place. We've got our list, we've got our keys, we've got our criteria. All we need to do is get to drafting, and it's going to be an easy job. Because too many people around that October time, which is when you send off your application in year 13, is when you guys are like, hang on a minute, I haven't got this written down. And it becomes very stressful because you've just had your UCAT, you're thinking about which universities to apply to, perhaps you're asking your teachers to bump up your predicted grades. There's loads of things going on at the same time, and a lot of students become confused. So if we get the basics done early now, and everything flows on nicely from then. Okay. And on top of that, at the very end, I've got something very special to announce. We've got our admissions guide coming out, and I'll share a link with you guys of how that can help you. And I 100% recommend reading it. It's going to be 100% worth the read. Okay, guys? So that is the plan for today's webinar. So for those of you guys who don't already know us and are new, welcome to the Medentors community. We are a team of UK medical, dental schools, and doctors and dentists who support medical and dental students getting into these careers and degrees. Now, we understand it's very difficult to get into, which is why we've got free webinars, such as this one that we're currently in, that highlights the whole application process, breaking it down and sort of showing you guys how everything goes. And hopefully from then, it's like easy for you guys to understand what the next steps are and it's foolproof. Okay. And within that, we've got our mentors who help assist you guys in doing webinars. Like, for example, today I'm joined with Aladdin. And we've also got our Academy, which helps you guys with A-Level and GCSE tuition, just to help you boost that grade to make sure you don't miss out on those offers. And we work with a lot of schools. So if you're interested in us visiting you guys, then get your head of year involved, get your medical society presidents in, and would love to visit you guys and give a talk and collaborate. Okay, so that's other stuff we do. And so far, we have reached out to 3,000 plus students that we've had within our courses and webinars, and 95% of the ones who are enrolled within our courses end up getting an offer. And we work with 20 different schools and organizations. Okay, so that's sort of the impact and reach we've had over the last couple of years, which has been really astounding to see. So, the plan for today, let's break this down. So, you're joined with me. I'm Mohammed Mufti. I'm one of the medical students, and also Aladdin, who's going to be introducing himself very soon as well, who's also a medical student. And we're going to break down everything you need to do. Okay, so the plan for today, for those of you guys who just joined the webinar and aren't aware, we're going to go into what applicants get wrong, what is needed in the personal statement, and what it's there for. Then we're going to break down the ingredients of how these work, and then we're going to look at how all the experiences come together. We'll look through some examples, we'll make it interactive, engaging, see what you guys think of them, and then look at what you should be doing now, what steps you need to take, what sort of things you need to be looking for, and what to do from there on outs. Okay, guys? Cool. Okay. And at the end, obviously, there's a Q&A for you guys to ask any question you want. And of course, the recording will be up on YouTube, but I recommend you guys getting involved because this is a really good opportunity we've got today.
Right, guys. So we just got to start off with why you have a personal statement in the first place. And obviously, um, you might not think the personal statement is something fun, or sometimes you don't think it's necessary. I know I thought it was a bit of a useless thing back in the day, but like it is important. I do kind of see its value for universities now. And the reason you want to know the reason is because like you just need to figure out what the examiner or like interviewer or university admissions officer is looking for when you give a personal statement. So, what are they looking out for? What are the reasons that they've put it in there? And how can you sort of take advantage of that? So, first off is going to be a non-academic impression of you. It's the only time before the interview that they see you as something outside of like an academic list of grades. It's the only indicator of you being a human and what sort of person you are. And that really applies for medicine and dentistry because you're always dealing with patients, dealing with vulnerable people. You're not, for example, like a physicist, you're not sat there doing theoretical physics. You're dealing with people, and that's why they care about the person you are, not just the way that you think academically. This is probably the part that you'll care about most. It's used for shortlisting, pre and post interview. So you apply with your UCAS application with your grades. You'll submit a personal statement along with it, and they'll have a look at that and then decide who are they even going to interview. So that's the pre-interview shortlisting, but also post-interview shortlisting. So a lot of universities, what they'll do is they'll shortlist. They'll have their interviews, And then after the interviews, there's still, too many people are good enough to be given a place. So they'll start looking at other factors like your UCAT or your personal statement. So it is like a pivotal thing. A lot of people say it doesn't matter anymore. It does still matter. It's very important. And then finally, it's going to show your motivation and suitability beyond grades, but most importantly, the way you reflect. So if you're going to take anything away from today, it's all about, ingredients of a personal statement. But if that it can be summarized in one word, it's going to be reflection. Um, so yeah, a sort of question that they're asking themselves while they're reading is the student ready for this profession anyway? So if you have a quick look at how long admissions tutors take to read a personal statement, first of all, if you look at this sort of like circular chart, you'll see we're dealing in minutes. No, we're not even dealing in double digits. It's all single digit, which is kind of surprising, or at least I found so. So we're thinking vast majority under 1 minute or under, if you include the 1 and 2 minutes, we're looking at about 75% almost of the personal statements. So they're basically getting no time whatsoever. Only a minority of them is going to get above 3 minutes. And even 3 minutes isn't, very much for a long time. So basically, all this tells you is your personal statement, you're not going to focus on the intricate details. You're not going to focus on trying to write a work of literature. You just need to make it be like efficient and take effect. So make sure your introduction is good and just bear in mind that it's going to get skimmed over. You want it to be that sort of read. So time for a bit of hard truth. So a lot of people when they write a personal statement they think I'm going to stand out. It's going to be something no one's ever seen before. It's going to be dramatic. Is going to be excellent. But put yourselves in the shoes of someone who's an admissions officer. Most personal statements are going to sound the same. And that's okay. You might think, I don't want mine to sound like someone else's. To a certain degree, that's not bad. It's not a terrible thing. It's fine if it sounds like other successful application personal statements. So you're not trying to be the new pioneer of personal statement writing. You're going to write something that is a tried and tested method, and it's the sort of thing that the officer will look at and say, I've seen one of these before. I can tell this is a good personal statement. It goes in the good pile. That's the sort of approach you want to take. You're not going to try and do anything crazy. Especially for medical and dental applications. Anyone who's applying to medicine and dentistry has already sort of, picked themselves out for a difficult like career, especially difficult university application. So it's not like the personal statement for almost any other degree, because most other degrees, the personal statement, to be honest, does matter less. They'll look at grades more, that sort of thing. But for these two paths, medicine and dentistry, people who are applying with a goal in mind. They're going to write there as well and have good experiences as well. So don't. I suppose that takes the pressure off a bit. Don't expect yourself to, be soaring above everyone else's writing or everyone else's, things that they put in their personal statements. They're all going to have good things, but that's okay. It just means that you need to find a way to present yours well. So yeah, and that brings us to which ones are actually going to stand out. Right, so if we look at the ingredients of a strong personal statement, we've got five here listed nice and clear. And you do well to actually make a note of these because they are almost present in every good personal statement. So we're looking at work experience. It just shows you understand the profession. I'd recommend you allocate a good chunk of your personal statement to this, a good paragraph or two, like a good amount of writing, because this, along with volunteering as well, so that we'll get to that soon. That kind of comes under extracurriculars possibly, but like those sorts of experiences that you built, either clinical or non-clinical, but obviously preferably clinical, they just show what you're getting into and you've got insight. Because a lot of people say they want to do medicine or dentistry because they've been passionate about it since they were kids, because they want to help people, but with no understanding of the career whatsoever. So, and this is where you get to show it before the interview. All you've got is your grades and this. So this is how you're going to show you actually know what you're getting into in the first place. Looking at supracurriculars, Mufti's going to be talking to you about that soon enough in more detail, but we're looking at sort of showing academic curiosity. Both medicine and dentistry, very academically heavy courses, very like academically respected as well. So they're obviously looking for a good academic and not just someone who, not just someone who is doing well in their A-levels or whatever, but someone who shows that they want to do a bit more, because part of medicine and dentistry is to teach, is to do research. It's not just to treat patients. So you got to play that to your advantage. Um, Extracurriculars, so we kind of touched upon that before. So you've got leadership, teamwork, resilience, all these sorts of common skills, empathy as well. You're going to draw these from your extracurricular activities, like being the head of your football team, for example. Or, by the way, a lot of people will say, "Oh, I'm not the head of anything. I can't, I'm not the head boy. I can't mention that." Easy one is volunteering. There's, charity shops are begging for volunteers, and by this stage you're old enough to start volunteering in charity shops. They will take you on. So that's like a method that I've been preaching for a very long time, is like volunteering anywhere, like a charity shop. Your local mosque or church as well, very easy place to volunteer. So volunteering is 100% going to give you experiences that is going to make you a better person, and that's not a cliche, it's true, but also it's going to give you a lot to talk about in your personal statement and in your interviews. If we look at hobbies and interests as well, allocate, a section of your personal statements for this. Don't make the mistake of making it too long, but nevertheless, they do want to hear about your hobbies and interests. They've got that there on their checklist. Just show that you've got a life outside of academia. If possible, show how it links to your career, but don't just sort of list things. That's not what you want to do. You don't want to just list, I've got a black belt in Taekwondo and I do football." That's not really what they're looking for. They've read 1,000 of those. You want to show a bit of reflection about them, and that kind of leads us to the final part, what you learn. You're going to reflect on all four previous ingredients, not just the hobbies and interests, but yeah, basically never list anything. They're achievements and they're respectable, but they're nothing if just listed. You really need to show what you took away from them.
Okay.
Okay,
Thank
thank
you
you
for
for
that,
that,
Alauddin. So, for what we're going to talk about now
There's going to be
is
Easter Sunday. Hmm?
yeah.
Easter
So
Sunday.
what we're going to talk about now is
Meaning you have to go
supercurriculars.
to
Now,
volunteer
this is
this
something a lot of
morning.
people get confused
I
with.
think you can.
Okay.
Sorry,
Just
could
two
we just
hours,
mute? I think
please.
someone's speaking. Yeah, thank you. Okay, so what we're going to be doing with regards to supercurriculars is a lot of people get this confused. They don't know where to start, what to tackle, and where to begin because they see it as, oh, it's research. I have to read into something. Oh, it can get brought up in my interviews. Oh, it's needed for your personal statement, and it's something completely new that you've never done before. And that's where a lot of the anxiety comes from. Now, I'm here to show you guys that this is something that can really be broken down, and it's something that you guys can tackle step by step. So, firstly, what are supercurriculars and why do you need them? Does anyone know what the difference between supercurriculars and extracurriculars are? Can someone tell me in the chat? What's the difference between supercurriculars and extracurriculars? I can't quite see the chat right now. So Aladdin, if you could read out if anyone's got any good answers. Yeah,
Yep, let's have
exactly.
a look. So we've got so someone said outside of curriculum, but clarifies that extra or supercurricular, because only one of them applies to that.
Yeah.
Link to course, again, is it super or extracurricular? So have you told them to define one of them?
Yeah. I think Khadija Khan, she's got the right answer. So yeah, exactly. Extracurriculars are things you do outside of your studies that make you a well-rounded person. Think about your hobbies. Think about sports. Think about things such as, being school captain. These sorts of things you're doing to make yourself a well-rounded applicant. That's your extracurriculars. And we're going to be breaking that down very, very soon, going into some of the later slides. Supercurriculars might just be the polar opposite. It's showing you why you're pinpoint dedicated into this career of medicine and dentistry. You've seen the degree and done your work experience, and now you're so interested that you're going to find a specific topic and you're going to research into it. Okay, you're going to pinpoint a topic, you're going to research into it, look into the why, look into the how, look into some articles, some research papers, and really make the most out of it. Now, supercurriculars, do you need them? The number one myth everyone asks about. Yes, they are 100% required of us. So this webinar will be breaking down what steps exactly you can take to get a head start with this sort of thing. Okay, so it's something you definitely need. It's essentially some sort of research or wider reading you do in a specific topic, and you need to talk about it in your personal statement, preferably within question two. And it's also something that often gets brought up in your interviews. For those of you guys who have a bit of insight, and don't worry if you don't about interviews, essentially it's made up of different stations, and one of the stations in your interviews is the motivation station for medicine dentistry, and they'll ask you, what wider reading have you done to show insight into this career? That's where you need to talk about your supercurriculars. They may ask you, what research have you done into this sort of thing? Why medicine? Like, why dentistry? They'll ask you. You need to bring these things up to show, I was so interested in this career that I actually looked into a specific topic. Now, some examples of these topics that we've talked about are things such as researching obesity treatment after seeing NGP work experience. Now, this is something personally I did because I linked it nicely to my work experience where I saw a lot of obesity and diabetes related patients, and I saw that the treatment based for it was often lifestyle and advisory. However, many people nowadays are taking shifts towards taking injections and pills like your Monjaro or Ozempic, and that causes weight loss. However, obviously, it's at a cost. And I researched into some of the side effects and also talked a bit about the psychosocial factors, which universities love because it shows you're considering a patient holistically. That's just an example I did. Feel free to take inspiration, but I generally recommend you guys find your own. For dentistry, you can do topics and things along the sides of, let's say, I don't know, water fluoridation. You talked about the ethical ideologies behind it, or perhaps different techniques of, treatment and molds, etc., filling materials such as your amalgam or composite bonding, all these sorts of things. You can look into different depths of the career paths. And what I recommend you guys to do is just find something you're interested in. If you can't find something you're interested in, you might just be picking the wrong career entirely. Because if this is something you want to commit your life towards, you've got to have something of interest. So find a topic and begin thinking about it. Now, what this shows is it shows that you're truly curious about the career and if you can reflect on this, which we're going to break into very soon, and I'm going to get you guys to go through some examples with me, what we're going to see is how to go about doing our supercurriculars. Okay, so let's break down the steps of how to actually do this. So you found a topic. Let's say you're interested in, I don't know, the history of surgical tools or amalgam bonding or dental technology or anything of your interest. You found something. Okay, now that you've found this topic. Now you're going to read a bit further into it. So what I'd recommend you to do is just get a general idea of what to know about it. Now I know it's going to be really tempting to use ChatGPT to do all your research, and actually it's not a bad place to start. ChatGPT is a very good place to start for your research because it gives you a good definition, it breaks it down for you, and I wouldn't discourage you guys from using it. However, when it comes to research, you want to be looking at articles on places such as Google Scholar, PubMed, and other healthcare websites like the NHS website or any other healthcare source, okay? That's what you want to look into. So what you want to do is get a general overview. Let's say for my obesity presentation that I did, what I did is I just ChatGPT'd. Well, there was no ChatGPT back in the day. I'm not that old, but yeah, there wasn't any back in the day, 3 years ago. I had Google instead. So yeah, I Googled it, read into the topic, and I saw how obesity affects people, its impact on health issues like heart disease, liver disease, dementia, or the onset of all of these things. Then I looked into other factors like where is it more prevalent? Is it more prevalent in socioeconomically deprived backgrounds or more affluent backgrounds? And when have we seen a spike in obesity? For example, we saw a huge spike during COVID. Why? Due to lockdown, people were at home living sedentary lifestyles. And I looked into the impact on mental health. I just did all of this general research on that sort of thing. Once you've found a general understanding of what your topic is on, you want to do is read a bit further into it. Now, this is where you want to look into articles. So go onto Google Scholar or go into PubMed. I'd say Google Scholar is a bit more friendly. Talk about, let's say your topic's on, I don't know, obesity, let's say mental health impact of obesity. Search that up on Google Scholar and you'll see a huge list of articles. Now, some of them have paywalls behind them. However, the majority of them you'll be able to access for free. So any free articles you see, or even on the NHS or any trusted websites, read through them and make a list of the source you used. Now that's going to come very important right at the end when we begin referencing. So make a list of what source you did. Just copy the link the web link for it and just keep a note of it. Like have like a Google document where you have all your notes for all the links. Once you've done that, try to construct some kind of idea of what you need to talk about. You probably want to break this down into mini topics, like, for example, the causes of obesity, the health risks like heart failure, hypertension, and liver disease, and then the social impact. What economic backgrounds does it impact? Treatment options like lifestyle, Monjaro, which is like injections you take as a last cause, or surgery, where people essentially cut their stomachs. It's called bariatric surgery, where you cut the stomach and make it a bit smaller so you get full quicker and how healthcare professionals interact in this. For example, dealing with patients empathetically, speaking with them, taking time out of the day, giving them lifestyle factors, signposting them to resources. These sorts of things are what we need to consider. Okay? Then what you need to do is be active about it. Universities love this. If you have a school medical society, that is a gold mine to get your supercurricular out there. Speak to the president, speak to the teacher in charge, and say, can I present at the medical society on this day? It will just be 10 minutes. And of course they'll support you. In fact, there's plenty of students probably already doing these sorts of things. So get a slot in. asked to present. And don't worry if you're shy at standing up in front of people. It's something that you just have to develop the skill for because when you get to interviews, you're gonna be expected to speak in front of people. So it's something that you gotta build up now and give a quick 10-slide presentation. Break it down to 10 slides and into all the different topics we talked about, the themes like causes, health risks, social impacts, that sort of thing. Okay, once that's done, once that's done, at the very end, you want to reference all the sources. So, like I told you at the start, make a Google document of all the sources you used. Then at the very end, you want to have your references. Now, for the references, there's a specific way to do it. It's something called Harvard referencing. There's really good YouTube videos out there which show you how to do it, and it's actually really easy once you get the hang of it. So just watch some of them and make sure you have the date of when you access the source, because that links on quite nicely to Harvard referencing, and you can just fill in all the information and put it there right at the end. Yeah? Okay. Before I move on, is there any questions? Because that might have been a lot to take in. No? Aladdin, I can't see the questions, so if you could read out if anyone's got any.
Don't think there's been any questions in the chat. There's
Okay.
been questions about suitable topics that I've answered, which some of them we'll use them as a quick example, possibly. So would inequalities in access to dental care be a good topic to research into? Which would be
There's no such thing as a bad topic, guys. Anything you're
exactly,
interested
yeah.
in, you can. For example, I know people who did something not medical at all. They talked about history of medicine, like history of tools people used, like scalpels, cuts, blades. How butchers, by the way, used to do a lot of the medical processes because they knew how to cut. They were used as surgeons back in the day. They talk about history, anything that interests you, because you just have to show that you're interested in the career. That's what universities are looking at. Can you do a bit of research? Can you show you're interested in things? And can you put yourself out there and present maybe things like that? But yeah. And for those of you guys who don't have a medical society at school, we've got the Medentors Society, and we're going to be starting supercurricular options and projects up very soon. So definitely keep an eye on the group chat if you're not already in it, where we're going to lead you guys onto that. Okay? Cool. So let's talk about the personal statement changes. Now, the personal statement essentially was broken down in the last academic cycle into three questions. Before that, it was just a 4,000 word document where you just answered why you want to do medicine, dentistry, pharmacy, whatever. Okay? Now, as of last year, they broke it down into three questions. And the three questions, we've just simplified them for you guys on the slide, as you can see. Question number one is why medicine, why dentistry? Question number two, what have you done to explore the career? And number three, what you've learned from that. Very nice and simple. Now, the good news is universities don't really care about the three question format that much, so it's not that much of a big change as people are making it out to be. So if you're reading articles online by other people who are saying, oh, it's such a big thing, it's not the biggest thing in the world. Universities still receive it in the same format. It's just important to know what goes where. And even if you don't get that right, it's not the end of the world. They care more about the content rather than where certain bits of your answer is for your personal statement, whether it's in the right section or not. Because I'm pretty sure they just receive it all as one form, anyways. It's sort of to help people verbalize and think about their answers, if that makes sense. So once you have that down, you want to think about these simple factors. Now, supercurriculars would probably fit within the category two because you're exploring deeper into the career. And why medicine dentistry is where you want to talk about your work experience and your initial motivation, what you enjoy, and what you've learned is where you talked about things like your key skills you've shown, like empathy, communication, maybe through volunteering, through work experience, whatever. Okay, cool. Right. And this is some advice that we had for this. I've sort of already covered over this, so I wouldn't worry too much about it.
Yeah.
Okay. So
Right, so if we have a quick look at some core values, obviously we've got a good list here. Don't try and I used to when I was applying, I used to think, oh, I need to remember a certain list of values like empathy, being able to prioritize, communication. I wouldn't take it as a list to memorize. I would take it as principles that you want to have had a look at and practice so much that you become fluent in. Like you don't, when you were learning English as a kid, you weren't memorizing the words. You were just speaking English enough, and you managed to speak it now. That's the sort of approach you want to take to interviews. You just want to, and personal statement as well. You just want to read around the subject. Attending webinars like this, for example, is extremely valid a way to prepare. It's not just a way for you to learn how to prepare; it's preparation in itself. So, this list of words that I've got here, don't try and memorize them. Just kind of take them to heart and see how you can apply them. So we're looking at communication with anxious patients, as well as a ton of other scenarios with sad patients. With your colleagues is a really important one that links into teamwork. So communication is one of the most the biggest core skills. That and empathy. Um, We've got teamwork. So MDT is a really common phrase that you want to be able to use. For example, if you reflect on how you saw the MDT operate in your work experience, that's a great thing to talk about in your personal statement. For those who don't know, MDT is multidisciplinary team. So multi-disciplines, as in different disciplines, like you've got the medical aspect, doctors, you've got nurses to assist, you've got something like a radiographer, a physiotherapist. These are all different disciplines coming together to treat one patient, as well as obviously the non-clinical side as well. You've got the admin team in the hospital, the admin team in the GP practice. They all take a role and a very important role as well. Um, so yeah, looking at some time pressure and prioritization. So MMI is obviously a great example of time pressure. All the stations are timed down to the second. But you want to before you get to an interview, you want to show how you can manage time by, for example, talking about a scenario that you've had to do so during your volunteering. So again, reflect on time pressure and prioritization. Confidentiality and professionalism. Obviously, learning when and how confidentiality should be maintained. Any reflections that you have on that? For example, there's a couple laws that you should read about, like Gillick's and Fraser. That sort of thing links to when confidentiality and like autonomy as well can and should be broken. And then have a look at professionalism as well. Obviously, maintain professionalism at all times, but the nuances of how you can do that are a reflection that you can have. Managing difficult conversations, which links back to communication. Emotional resilience as well. They're very tough degrees, medicine and dentistry, and the careers only get tougher. It doesn't get any easier. So show how you've got the resilience to take it on. That's a very key box that you need to tick in your personal statement. They will always be looking for someone who's ready to take the career on. And yeah, just at the end, we've got a little sort of notion that all of these core values, they can be linked to work experience, volunteering, leadership roles, team activities, anything like that. So just bear that in mind. So here we've got sort of like 4 point structure to master the actual art of reflection. And this kind of helps just simplify it. So if you were thinking reflection is a bit of a vague topic, hopefully this, takes the ambiguity a bit. So number one, description. What did you see? So you got to, your own work experience. You've seen something interesting. You want to reflect on it. You start, first off, you got to write what you actually saw. Then you're going to look at what traits or skills you observed. So thinking back to my personal statement, I remember writing about there was a midnight emergency. I was with a consultant. And so obviously I introduced the situation. It was someone who'd come in with a blocked, artery and supplying their heart. So their heart was having a heart attack. So what sort of traits and skills did I observe? I would talk about, his professionalism, his ability to get there immediately, the way he arrives in the sort of efficient communication with the nurses who had already started to attend to the patient, with the radiographer who was present there in the tech lab, because they're going to go in, use an X-ray to take, the blockage out. So that sort of communication between the MDT, that could be an example of a trait or skill that I've observed. Then you got to think, what about me? So how have you applied these traits? So you take inspiration from what you saw in your work experience and you think, how have you already applied it, for example, in your own volunteering that you've been doing? Or how are you going to apply it when you were a doctor? So have a sort of reflection on that. And that kind of leads us on to the fourth point. How is it going to relate to your degree or career? So you've shown how you've, taken these skills and applied them to your own life. And then you just got a sort of a little bit of a link at the end. How is it going to relate to your degree or career?
Okay, guys, so what we're going to do now is break down some of the factors that we'll look at when we reflect in our personal statements, sort of about what Aladdin was talking about in the previous slide. So over here, I've got examples of either good or bad reflections. Now, I'm going to need you guys to read these and in the chat, let me know if they're good or bad, and I'm going to get you guys to unmute and give your reasoning. So I'm just going to give you guys a minute. What do you think, guys? Yeah, not specific enough. Anything else? Yeah, yeah, exactly. Add more information on what they researched, didn't state what they learned or understood, include examples of articles. Now remember, guys, the personal statement is 4,000 characters. You don't need to include your references on there. It's more so you just have it on the background. You can put it in your presentation that you might do, for example. But personal statement, just talk about what you took from it, because there's not much to talk about and it wasn't vague enough. Can someone unmute and tell me what they think about it in a bit more detail? Would any of you guys like to unmute and let me know? Aisha Nalva, would you like to unmute and tell us? Why do you think it's vague?
I think it's vague because they just sort of said that they enjoyed reading it and have read a lot, but they've not really specified what they've read and how and what they've taken away from it. For example, if you read like a medicine article on like, let's say the effects of a certain treatment, they should specify it and say that, oh, this is an alternative, etc., and just sort of explain it in a bit more detail and how when they become a doctor or dentist, how they would apply it and what they have obviously taken from it.
Excellent, yeah. I think you're an expert already at this because that's exactly what you need to do. Go into specific treatments, what the side effects are, how that happens, these sorts of things. So you talk about what you learned from it, what you saw, how that makes you an effective doctor, and different diseases. That's really good. You can break down diagnostic processes as well. Talk about them in a bit of detail in your personal statement if that's something you researched into. That's a really good answer. Well done. And yeah, guys, so just to summarize, I think you guys have really hit the nail on the head here. This is an example which isn't specific enough. It talks about different diseases, but you can talk perhaps about what you researched, perhaps what you learned, time management skills. You have to do a whole super curricular alongside your A-levels. That might have been difficult for you. So talk about that side of things as well, okay? Cool. Moving on to the next example. Give you guys just a couple minutes. What do we think, guys? Can I get ideas in the chat? Yeah, it's more specific and well developed, detailed, and links to work experience. Really like that. The fact they link it to work experience brings a real life aspect into it, which universities love. Yeah. Relevant to contemporary medicine. Yeah. Talks about the MDT. I like that. By the way, just as a side note, some universities they're very strict with you using abbreviations in your personal statement, so try to avoid it and write down multidisciplinary team. That's something very useful. That's why they've written down British Medical Journal and not BMJ, for example. So that's just a side note for you guys. And specific, detailed, good follow-up actions. Interested. Um, talk about what they read. Yeah, Farhan, could you unmute and tell me a bit about what you liked about it? Okay, microphone doesn't work. In that case, Arcia, could you unmute and let us know?
So I thought it was a really good reflection because they referenced where they got the information from, and they were really specific in what they were interested in, and they reflected on it afterwards, explaining how it linked to the multidisciplinary team, and they highlighted the skills that they got from it, and also what they did afterwards, which was like talking to their pharmacist during their volunteering placement.
Exactly, yeah, really good. So They're very good in this example at talking about how they went about to discuss with the pharmacist in more detail about it. They didn't just leave it at their project, give a presentation and whatnot, do a bit of research. No, they went out their way, spoke to a pharmacist about this, got a professional insight into this, which essentially piques their curiosity. That's something that's going to help you stand out. So if you can add like a little side note there, that'd be useful. Yeah, well done, guys. We've smashed that one as well. What about this one? I think this should be pretty straightforward. It's just a one-word answer I need on the chat. Yeah, too short. Yeah, I guess people don't like this one. I think what it is if you guys see a short one without even reading it, you can just say that it's the wrong option and it's too basic. And to be fair, that's sort of why I do my medical exams as well. Like if I don't know the answer, I just pick the longest one because it's probably right. But it's not always the case, and I don't recommend you guys to do the same. Anyways, let's move on. What about this one? Moving on to our extracurriculars now. Yeah. Abdullah, could you unmute and tell me what they've done different in this example as compared to the previous one?
Yeah, so they've added more details and they've actually said how they're gonna how they've put this into practice instead of the other one, which is more vague.
100%, yeah. So they've been more specific. They went into detail. They didn't just tell you, I'm a good captain because I can organize things. No, I organize training sessions at a set time every week, let's say. I talked about difficult losses, and I understand that losing perhaps is a process within, football. And that's why I was able to rejuvenate the team and get our motivation back together. And that taught me effective leadership. I'm not just saying leadership, effective leadership, because it has an impact. And maintaining morale, encouraging constructive communication. These are key words. Remember, in your personal statement, when we get to it, around when you guys are writing your first draft, maybe after your UCAS exams, talk about in specific detail what exactly happened. Don't tell me, show me. That's what we're looking for. And I think they've done a really good job here. Excellent. Next example, moving on to hobbies. Whilst you guys answer this, I'm gonna answer some questions that people asked earlier. I think someone asked about EPQs for supercurriculars. I'm not sure if you guys have seen my message on the chat, but EPQs, they're not needed because there's easier ways to do supercurriculars. You can do them, and I personally did one, but it's probably low return on investment because it takes so long to do one, and it's just worth a supercurricular. That being said, EPQs are an excellent way to, get involved with research early, and it teaches you sort of the sort of things and skills you need for actually being a doctor or dentist because you're going to be researching a lot. So it actually gave me a head start for like a lot of university assignments I'm doing. So from that perspective, it's really good. Yeah. Okay. It says in my free time, which makes it as though it's not a hobby and doesn't relate to future career either. Yeah, I can hear that side as well. Marwa, could you unmute and tell us what you would say differently for this example?
I was just gonna say that maybe they should like talk about the skills that they've learned from playing football. Like, for example, if they were the captain of the team, and then like how could they apply those skills in their future career? Because it doesn't really talk about what they want to do in the future.
Exactly, link it to your future career. So gym helps me relax. Okay, what's that got to do with anything? Now tell me, medicine is a difficult career and I can understand it can be quite daunting. And the best doctors are the ones who have the best work-life balance. That's why in my free time, I like to relax by going to the gym and also socialize by going with my friends. This allows me to, pursue the physical side of my life and essentially use it as an outlet for relieving stress. Something like that. That would be a good reflection. When we get closer to personal statement season, I'll send you guys some examples of model personal statements we've got coming up very soon. So that's something we can focus on. But I wouldn't worry too much about this right now. And this is obviously an improved example. I'll just give you guys a bit to read it. I'm sure you all know it's a good example. I'm just gonna give you guys some seconds to like sort of draw it in. Okay, so that's a quick summary of everything we need to talk about at that stage. Now we're going to break down what we need to do right now and how you guys can utilize your experiences and your free time, frankly, in year 12. Because you guys have a lot of free time right now in year 12 to build up things for your application. Because when you get to that UCAT summer, then your mocks, and then alongside your mocks, you're doing your interviews. When you get to that crammed 3, 4 months of interview prep and UCAT, it gets burnt out. You really do get overburdened. So try to make the most out of your free time now to make the most out of things. So I've written a list of the sort of things and competencies we need to be focusing on right now at this current stage. First thing I want you guys to do is when you do your work experience, and if you've already done it, for those of you guys who haven't done it yet, go and keep a log with you, a nice little notebook, and keep it handy because you'll make notes essentially of what sort of things you need to say. And if you see anything interesting, like let's say you see a surgeon performing a certain procedure, or you see a doctor consoling a distressed patient or someone with anxiety issues before a procedure, or someone who has a long-standing condition and how they're going about coping with it, and how a doctor may have eased their worries and maybe made it a bit easier for them. Or let's say a dentist saw a young child who had dental anxiety and was scared, so he desensitized them a little bit to the instruments by playing with them and getting them more used to it and having a playful tone. These sorts of things, whatever sort of small things you see, have a log, have a notebook, and just keep general ideas of what sort of things you're seeing, just as bullet points. This is going to be golden going into the future because when you're reflecting, you can reference right back to this, and just like that, it will stick in your long-term memory. Okay? That's what you want to do with your work experience. Another thing you want to do is start supercurricular reading. Now, we don't all expect you guys to have some sort of project or idea. And to be fair, you don't really need to present it. We just at Medentors tell you guys to present it if possible because you need those skills in getting used to speaking in front of people. That's such a key skill, not just for interviews and not even just for me as a med student because I get scored a lot. Like just a couple weeks ago, we had to do like a verbal presentation and that counted towards our grades, and it's something that contributes towards a lot of things, but also as a wider career as a doctor, as a person, you become a lot more confident when you learn these key skills. Like a lot of doctors nowadays, because many of you guys, if you guys have seen on the news, there's the competition ratio for specialty careers is really steep, and it's very difficult to get places after you graduate as a doctor into training. One of the key aspects you need to cover is interviews and research. When you research and do interviews, you need to present, and you need to speak to other people in the interview. When you develop these personal skills, they're not just going to help you now for your application, they're going to help you later on in your life. So get used to presenting, being in front of people. These are the real key skills we're looking for. And once you start reading into supercurriculars, find out what you want to do. Don't stress about it too much. I think your supercurricular should take maybe max 5, 6 hours to do research, make a quick PowerPoint presentation, reference some articles, and get it all done with. Whereas if you did like an EPQ, it would take like 100, 200 hours. I mean, nowadays you guys have ChatGPT, but back when I did it, it took me forever to do my EPQ. And I don't regret it. I think it was amazing because it taught me key skills and it's very formal, and I like that. But I'm just saying, if you don't think you can bounce your A-levels, it might not be the best shot to take. And another thing you can do is, take on roles. Like if there's a school captain availability, if there's a senior hockey team position, if you're, anywhere volunteering, care home, whatever it is, take on those roles, get involved because again, bring back your notebook, jot down your experiences. And also your hobbies. Make sure you're a well-rounded person. If you're the type of person that's just study all day and sleep at night and that's your whole life, eat, sleep, study, repeat, that's not going to get you very far because you're not going to be remarkable enough in your interviews to stand out. So try to build on some hobbies right now. Play some sports, talk about them, like instruments, sports, anything you like to do in your free time. Yeah, keep that noted for now. Okay, guys, so that essentially concludes everything. But before we go on to the Q&A, I'm going to make you guys aware of what sort of things we've got coming up next. Next up, next week, we're going to be looking at inside life into what life is like as a medical and dental student. That's part of our Medental Society. Medental Society is essentially us bringing on doctors, dentists, healthcare professionals, and even medical dental students sometimes to talk about their career, how it's like for them, what their day-to-day activity is like, just to give you insight into what you're signing up for. Is this something you actually want to be doing? And the presenters will be me and Kareem, who's a dental student, breaking down what it's like to be me, a medical student, and Kareem, what it's like to be a dentist. And we're going to show you what our day-to-day life looks like. And you guys can ask us any question you want, really. How much time we get, how the workload is, how we feel about certain things, hot topics, whatever we want to talk about, okay? After that, we'll look into what makes a top 5% applicant. So this is going to be looking into what helps you stand out with your application, a bit of an extension on this presentation we've already got. After that, we've got some unconfirmed dates. We've got a society talk coming up very soon. with Dr. Tasneem, and she is at F1, so she's just finished med school. She will tell you how to make the most out of it as a doctor and sort of things she wished she knew when she was at your stage just before stepping into med school. And that might just be a reality check for a lot of people. And then our whole UCAT and personal statement webinar will be offloaded from May to September time. We've got loads, so do stick around. And we've also got something called the Medentors Admission Summit, where we're going to be going through the application cycle and also be going through lots of interactive group tasks and activities. This is on 30th of March, so the end of this month, and this is end of this month, and it's in person in Manchester, and it's only like £5 to sign up, and that's just to cover the cost of the venue. So please, if you're in Manchester or anywhere up north, sign up. If you have friends, family there that are applying, no matter what age group you are, you're year 9, year 12, 11, 12, 13, wherever you are, sign up to this. It's going to be very high yield and we're going to get lots done. Okay, cool. And this is just to promote our admission summit. So for those of you guys who are new and not part of our WhatsApp community, click the QR code here to join our community. It's a community of now 2,000 plus medical and dental students and as well as applicants. And this is where, you guys can ask for support and advice at any time. And follow our Instagram and there's loads of tips and resources. And for those of you guys who are struggling with your A-levels, we've got our other branch called Medentors Academy. This helps with tuition. So if you're looking for a tutor to help support you with your A-levels, with your GCSEs, to really help boost your grades, if you think you're struggling at the minute, book a free consultation with us. We'll pair you with an expert tutor. Not only will we pair you with a tutor, we'll try to pair you with someone who's suitable for you. So if you're looking to get into dentistry, we might pair you with a dentist who tutors your specific subject to sort of offer you that role model figure to help you get into the career and give you insight so you can get steps earlier. If I had this sort of like support when I was applying, it would have streamlined the process a lot better. So I definitely recommend you guys to take up these opportunities and make the most out of it. So definitely sign up and scan the QR code if you want to book a consultation. And you can also do it from the link in our description. Okay, cool. Now is the time for you guys to ask any questions. So if you guys have anything you guys are curious about, now's the time to ask. Me and Alauddin will be happy to take on questions. Okay. When should you start preparing for the UCAT? Very good question. Now, UCAT is something that you guys should start preparing in two phases. The first stage is you're just getting used to things. So that's what you should be doing right now. In terms of right now, 15 minutes, couple times a week, whenever you're free. So let's say you've got a study period or something and you don't know what to do, just open up the UCAT Consortium website and start practicing some questions. Start getting used to things. That's going to help you get into the flow of things. Just to be aware of the UCAT, do some untimed question practice, only 15 minutes. Don't do any mocks, don't do any subsections, just one or two questions. Learn what the UCAT's like, okay? Get used to it, the general flow of things. Now, when you get to the summer, after you've done your UCAS exams, everything's going to be a lot more easier. You won't be scrambling trying to learn what the UCAT is. You already know what it is. You're coming in prepared. And now you can just lock in for those 6 to 8 weeks. Have a good work-life balance, obviously, touch grass and stuff, but get prep in. Do your mocks, and but then your score will exceed. Now, the key is not to do too much work beyond that 6 to 8 week range. Okay? If you end up doing an intensive 12-week, 3 month UCAT like course and you're just going through everything, you're gonna burn out very quick. And that's a recipe to getting a bottom decile score. If you want to get that top decile score, you need to be prepared well in advance. Okay? Is taking A levels worth it in case med and dent doesn't work out? That okay. A levels for med and dent is useless. I would never recommend it in 100 years. If you're considering another career, like let's say engineering, and you want to take, let's say, physics along the side, or maybe further maths as well, you want to do it alongside your biochem maths or whatever, biochem whatever. What I'd say is do it depending on if you're still iffy about medicine. If you feel that you're not dead set on it, then pick a fourth A level. That's what I'd recommend you to do. Okay? Is there a preferred website to use for UCAT prep? Yes, there's something called Medify. However, don't purchase that or Medentry, but don't purchase those two until your intensive 6 to 8 weeks prep. Right now, just use the free UCAT Consortium website, which is the official question bank. Okay? The paid question banks, because official question banks are very small. You need paid ones. Use our discount code Medentals15. You should get 15% off, and that will help you guys from there. Okay. How to present supercurriculars if you're not in school. Mentor Society, we're going to be opening supercurricular applications very soon. Keep an eye on the group chat. For Oxbridge, are hobbies important? Yes, hobbies are important no matter what, even for Oxbridge. Any other questions, guys? Would working as a librarian count as volunteering? It would count as volunteering, but not an extra curricular. Extracurricular is not work, it's sort of like what you do sort of for fun. What course did I apply to? It varies per person. I did pharmacy, and funny story actually. I applied to pharmacy the fifth choice just because, why not? And I had no idea they do interviews as well. So I get an email saying, come to this interview. And I'm like, no, I'd rather not. So I just left it. But yeah, I didn't turn up to my pharmacy interview. But yeah, you can pick whatever fifth option you want. So essentially, for those of you guys who don't know, UCAS gives you four options to apply to, four different universities for medicine dentistry. Other people are allowed five, but medicine dentistry is so competitive, there's only four slots available. A fifth option is any other career other than that. And you can even do four med, one dent, and four dent, one med, vice versa. What should I do in year 11 summer holidays? Relax, please. Yeah. Work experience, probably do that in year 12. What should I start? No, don't start level prep in year 11. Thank you. Just focus on your GCSEs. A-levels is something that when you make a start on, you get in the hang of things. But honestly, just enjoy that summer. Yeah, after GCSEs, yeah. Even then, until September starts, just relax, honestly. Maybe get a bit of like build stuff like your hobbies, some skills like let's say you like cooking, sewing, piano, maybe you're interested in dentistry, you do origami for manual dexterity, these sorts of skills. Perhaps practice that, but don't do anything academic. Just do your non-academic stuff maybe, but just chill, honestly. Those 12 weeks are fun. Just relax. What if you're stuck between medicine and dentistry? Join our webinar next week. We'll explain the difference between the two. Okay. Aladdin, if you got anything to add to any of these questions.
No, they're looking good so far.
Brilliant. We'll just take a couple more.
Thank you, Mohammed Yassin.
Okay, if there's no more questions, then yeah, okay. So there seems to be no more questions, so we'll let you guys all go now. But yeah, thank you guys so much for your time. We've really appreciate having you guys on. We've got loads of webinars coming out, and we've also got YouTube videos which have the recordings. So go on our YouTube's Medentors channel, and hopefully this will be up as soon as possible. And we've got loads of webinars coming out later this week. Also keep an eye on the WhatsApp community, get involved, ask questions. There's no such thing as silly questions, honestly. So anything comes to mind, just drop it. We've got medics and dentists on the group chat for you guys to help answer your questions. And yeah, um, keep you in touch. Thank you guys. Goodbye.
Bye, everyone.